This program is brought to you by Emory University.
I think because I'm a public health nurse, I have the population level viewpoint of making what the services that are provided the most effective and also as close to the prevention end as possible, and that we reach those populations that otherwise are really not going to be reached.
You have a vegetarian restaurant. Why is that?
We do. Well, we had a campaign. It was called Biggest Winner, and it was focused on healthier eating and weight loss in the whole county. We had 4 different sites that had a competition, and they were looking for healthy choices. And our local restaurant in town had noticed that their clientele had kind of decreased, and so they kind of looked at their menu and got some healthier options. And they actually just went vegetarian about 4 months ago, and a lot of that they attributed to the Biggest Winner campaign.
Wow. They changed their lifestyle. You mean the owners of the restaurant changed their lifestyle? So they're healthier?
Much healthier.
Between public health as something that happens in the home and clinical health, ambulatory health that happens in the clinic, and we're really bridging that. Mm-hmm. So these clinical care coordinators are really doing classical public health. They're doing it in the clinic instead of in the home, but they're partnering with our home visiting nurses who are their eyes and ears in the home, the providers, the family practice providers' eyes and ears in the home. And so there's a real blending of those specialties.
I think probably more than anybody, public health nurses understand the real situations on the ground, the real life situations people face, what it's like day to day, so that they're in the best position to identify policies, barrier to policies, identify whether something could work or not work.
Really, I think nurses play a big role and are going to play a big role moving forward in the transformation of the healthcare system and just bridging those gaps and being there to continue to advocate for the patients as things change. Providing that education and assessing what those needs are and how they can better meet them. So I think public health nurses will be an even bigger part of healthcare moving forward.
The fact that we have, restrictions from the federal money that really is all we have. We don't have any state general fund in general public health or much local general fund, and we need it. And so I think that being leaderly, standing up, speaking out, speaking truth to power are all important things to do.
I think public health nurses have their finger on the pulse of their communities, and they know a lot about what nurses and what they've learned through nursing and what their communities need. So they need to stand up and speak for them. Our professional organization, the Nursing Section of the Oregon Public Health Association, had a legislative visit day, and a group of us went down to talk to legislators. We helped ourselves by finding out from legislators that were friends what kinds of things that we could do to help our legislators hear us. And we prepared for that. And then we visited with them and found out to our pleasure that they really had some good questions and they wanted to know what we had to tell them. So at the end of the day, I felt like we did something very important.
I really see this as a great opportunity. It only happens once every, this will be the only time in my lifetime that I think anything this significant is going to happen. And I really see it as exciting and something we can make a difference with. Just become part of the solution, not part of the problem.
The preceding program is copyrighted by Emory University.